I'm Dr. Jerome Zekman, and I want to talk to you about something very important. This is nutrition for your total joint replacement. This is probably the most important thing to optimize before surgery. It is such an important thing that I'm going to break this video up into two sections. There's the basic nutrition class, and then there's the deep dive nutrition class. If you are interested, the deep dive would be very helpful, but everybody should watch this basic nutrition class. So nutrition is the way we get you back to the life you deserve, a life in motion. It's very important for a successful surgical outcome. Out of all of the things that we do to optimize you before surgery, nutrition is probably the most important modifiable risk. Other things we talk about, and I will cover today, is smoking and alcohol, but there's things such as obesity, psychological things, prehab. These are things that are important to optimize, but nutrition has been shown to be the strongest predictor of a surgical good outcome. One of the things you need to start with is the knowledge that 50% of people are not nutritionally optimized. The problem with malnutrition is it increases infection rate, increases death rate, delays healing, increases a chance of being admitted to the hospital, and increases the cost of care. There have been studies in all different types of surgical procedures, including hip and knee, but also shoulder, trauma, spine, sports, hand. These have shown significant issues with increased complications, length of stay, readmission rates, mortality, and healing. And this has been well documented in orthopedic literature. So the problem at an anatomic level is a thing called sarcopenia. It's a big word, most people don't know it, but it means progressive muscle loss associated with natural aging and disability. It's worse with injury. Immobilization, stress of surgery makes muscle loss worse. And it's important to maintain skeletal muscle mass because it's important for your protein metabolism, your wound healing, physical strength, organ function, skin integrity, and immune function. So again, why nutrition is important? It's essential for addressing the surgical stress response. So to minimize muscle and strength loss, we rely on nutrition. If we reduce complications this way, it'll facilitate more rapid healing and it'll maximize your surgical outcome. Think of a chart that shows malnutrition with low albumin levels having high complications and normal albumin levels having low complications. You want to be in the normal albumin level. And that's the way we actually test for your nutrition. So when do you start nutrition issues? You start now. As soon as you get the idea that you're going to have surgery, you want to get prepared. It's like getting ready for a marathon, but at least begin a month before surgery and until fully recovered. The most important time frame is 1 week before, 2 weeks after. So points to remember that I will be going through on this is best nutrition comes from good foods. Avoid bad foods. More protein is required. Consider meal replacement nutritional drinks or essential amino acid supplementation. Supplements of key vitamins also may be needed. Other things to remember: avoid alcohol and smoking. Fiber is helpful to avoid constipation. Probiotics may be helpful, and stay hydrated. So what are good foods? Good foods are lean protein, fish, chicken, eggs, avocados, fresh vegetables, healthy carbohydrates such as bananas, buckwheat, sweet potatoes, fresh fruits, leafy greens, olive oil. Bad foods are refined carbohydrates, white bread, store-bought pastas, sugar-sweetened soft drinks, anything that has salt in it, cookies, candies, sweetened breakfast cereals. You want to avoid all those things. There actually is food that causes inflammation and foods that are anti-inflammatory. You want anti-inflammatory foods. Tomatoes, fruits, nuts, olive oil, leafy greens, fatty fish. You don't want the fried foods. You don't want sodas, refined carbs, lard, processed meat. If you are having surgery, you want to preserve your skeletal muscle healing and avoid complications. When you are in a hypermetabolic state, like after surgery, your muscles get used up as source of fuel. You don't want that. You want to keep your muscles. The only way to do that is by diet. you want to take in a lot of protein. Protein requirements are increased after surgery. 20 to 30 grams per sitting is recommended, or 65 to 100 milligrams per day. This is probably 3 times as much as you normally take in. It's best to probably eat 3 meals a day or 6 times a day when you are doing these type of preparations. Remember, high quality animal-based proteins are things such as chicken, beef, salmon, eggs, and milk. High quality plant-based proteins are things such as lentils, quinoa, black beans, soy, peas, spinach, and almonds. But you really can't get enough with this. You want to remember to use perhaps something more like meal replacement nutritional drinks such as Ensure, Boost. These are high in protein. Another thing that has been shown recently is that essential amino acid supplements a week before surgery and 2 weeks after can make sure that you're getting all the amino acids that are required. So people ask, well, what's 30 grams of protein? 30 grams of protein is 4 ounces of grilled chicken, 4 ounces of beef or hamburger, 6 ounces of fish fillet, 5 hard-boiled eggs are 30 grams of protein, 1 cup of cottage cheese, 1.5 cups of tofu. That's what 30 grams of protein is. To really get as much nutrition as you need when you're getting surgery, you probably have to take in 4,500 calories if you're a meat eater. If you're a vegetarian, you have to take in over 6,000 calories. If you're a vegetarian, you also don't get some of the specifics that are necessary, such as creatinine, vitamin D, B12, and zinc. So these will need to be supplemented. Nutritional basics can be improved by taking in these targeted amino acid supplementations. These may be very helpful. They are sometimes expensive. There are different types out there that you can buy. Talk to your doctor about these things, but that may be a way to really make sure you're getting the protein and amino acids that are required. Target amino acids are way better than the protein shakes. It may take 10 protein shakes to do 1 amino acid. Vitamin supplements. The vitamins that we recommend that you take that are necessary in higher dosage than regular are going to be your normal multivitamin, vitamin D3, which if you're not taking, you probably have to take 10,000 units a day to elevate, and sometimes it takes 3 months to get there. Vitamin C, 1,000 milligrams twice a day. That's going to be important for healing. Calcium citrate, 500 milligrams 3 times a day. Probably could get by with twice a day for that, but that's also important for bone healing, which is important in total joint replacements. And magnesium citrate, 500 milligrams twice a day. So why are vitamin supplements so important? It's because most Americans are deficient in so many of these. In fact, they did a study in 16,000 patients and found that almost 90% were deficient in vitamin D, over 50% deficient in magnesium, and 30 to 40% deficient in vitamin C. One thing that I have to talk about, even though it's not eating, is smoking. Smoking is so bad that you have to stop a month before and until fully recovered. Smoke steals the oxygen from your bloodstream. It delays healing, it increases infection rates, increases complication rates such as stroke, blood clots, heart attack, pneumonia, even death. Do you know that smoking actually has 4,800 chemicals inside a cigarette, and 69 of those cause cancer? Another thing you may want to do is avoid alcohol. Probably not as critical as smoking, but it does disrupt your sleep, it increases fatigue, and it's not good with pain medication. Fiber is another basic. Most people have difficulties after surgery because they get constipated. They're taking all these pain medication. You want to reduce that by taking in normal things such as fruits, vegetables, whole grains, but you may have to take over-the-counter laxatives such as Colace or Ducalox or Miralax. Probiotics have been shown to be helpful for a lot of things, but they also help reduce infections, improve digestive health, boost your immune system. These are things such as buttermilk, kimchi, anything that's a probiotic can be beneficial and prevent antibiotic-induced diarrhea. One other thing that's important for nutrition is hydration. And that's a really difficult thing to do because no one drinks enough fluids. You have to drink up to 52 ounces of water or unsweetened drinks per day. That's like 7 glasses per day. To do this, you may want to schedule yourself. Think about having a full glass of fluid when you wake up and go to bed. And also with meals, that gives you 5 glasses, and if you eat 6 times a day, you're really getting enough fluid. So again, the points to remember for nutrition basics. Best nutrition comes from good food. Avoid bad foods. More protein is required. Consider meal replacement nutritional drinks, or even better, essential amino acid supplements. Supplements of key vitamins may be needed. Avoid alcohol and smoking. Fibers necessary to avoid constipation. Probiotics may be helpful. Stay hydrated. So that's the basic things on nutrition. I ask you to think about going to the deep dive on nutrition, but this is the way we keep your life in motion. Thank you very much.